Aseptic technique is highlighted as an essential component in infection prevention programs. The ability to undertake aseptic technique is an important clinical skill for all healthcare professionals, especially nurses and midwives. It is used to support procedures such as cannulation, insertion of urinary catheters, blood cultures, wound dressings, and the administration of intravenous drugs. Aseptic technique is well established, and there is an assumption that all healthcare professionals understand its aims and when it should be applied. During the 1990s, the term of aseptic non-touch technique was introduced to further standardize clinical practice and is now recognized as best practice in several countries. ProPack Hospital from Medicare Plus International is a sterile, latex-free wound care pack designed for ease of use in an acute setting. ProPack Hospital is ANTT compliant and is ideal for use when undertaking an aseptic non-touch clinical procedure such as wound care, cannulation, and urethral catheterization. ProPack Hospital is available in 3 glove size variants with small, medium, or large nitrile gloves. We also offer a no gloves pack option. Preparation for use. Prior to preparing your workspace and throughout the whole clinical procedure, follow your hospital ANTT policy on hand washing, PPE use, and waste disposal. Preparing your workspace. Once removed from the sealed outer pack, place the wound care pack on a secure, flat surface such as a table, trolley, or a tray. Then, unwrap the contents of the pack by extending each corner of the green sterile field one by one. Follow the steps in this simple guide, starting with the visible corner tab as indicated here. Holding the pack with one hand, locate and gently pull on the tab. Pull the tab up and away from you. Then, locate the right hand corner and extend this fully to the right. Next, locate the left hand corner and extend this fully to the left. And finally, locate the fourth corner and extend this fully towards you. Once fully opened and flat, this area becomes your sterile field. Each pack contains the following equipment: 1 clear polythene disposal bag, 1 pair of latex-free, powder-free nitrile gloves in your chosen size, 1 tissue back drape, 1 paper towel, 1 paper measuring tape, 5 7.5 by 7.5 centimeter non-woven swabs, a 2-compartment tray, and 60ml galley pot. Sequence of use. Don a disposable apron. Then, with one hand inserted into the disposal bag, arrange the sterile equipment on the green sterile field. With your hand still inside the bag, you may now also choose to remove the used wound dressing or device from your patient. Holding the dressing or device securely through the bag, invert the bag, leaving the used dressing or device inside. When removing the used dressing or device, take extra care not to cause any unnecessary pain, discomfort, or medical adhesive related skin injuries such as skin stripping. Consider the use of a medical adhesive remover such as lifties. This will break the adhesive bond between the dressing or device and your patient's skin, easing removal. Next, remove the red tape strip from the top of the disposal bag and stick the bag vertically, near to your prepared green sterile field. And finally, prepare any cleansing solution required for the procedure using the galley pot. Chronic wounds may be cleansed with tap water. Please refer to your hospital policy for details. Caution: when using cleansing solution in the galley pot, avoid contact with the pot edge from the solution bottle rim or outer packaging, and take care not to overfill the pot. And to avoid contamination during the procedure, always ensure that the pack contents stay within the confines of the green sterile field. Any additional sterile equipment required for the procedure, for example scissors, wound dressings, and devices, must also stay within the confines of the green sterile field as shown. Always avoid touching the green sterile field with the outer packaging of any additional items. Now, don the sterile gloves. You may now choose to drape the wound area with the tissue back drape. If required, a hole may be cut in this sheet using sterile scissors. Next, use the sterile non-woven swabs and your pre-prepared cleansing solution to clean the wound area. The paper towel can be used for drying around a cleansed wound or for placing under the wound area with a tissue bag drape as an extra sheet to absorb any excess cleansing solution or wound exudate. Once the wound area is clean and dry, redress the wound or replace the device as appropriate. You can use a measuring tape to check the wound length and width if required. To finish, remove the tissue bag, drape, apron and gloves. Dispose of all waste in the polythene disposal bag and in accordance with your hospital policy. This video contains information, advice and guidance to help healthcare practitioners. It is intended for use within the UK and viewers are advised that practices may vary in each country outside the UK. Whilst every effort has been made to ensure Medicare Plus International provides accurate and expert information and guidance, it is impossible to predict all the circumstances in which this product may be used.